We move on to the next presenter, Dr. HARSHAVARDHAN, GHORPADE, G14398, free paper 2339, Artificial Intelligence and Wolfram Language in Papilledema. Dr. HARSHAVARDHAN.
Respected judges, respected seniors, and my dear friends. Today, my topic is Artificial Intelligence and Wolfram Language in Papilledema. There are no financial disclosures. These are our contributors, including senior neurologists and ophthalmologists. The New England Journal of Medicine has published an article in April 2020 saying that artificial intelligence can be used to detect papilledema on the basis of fundus photographs. However, to predict the outcomes, we need many more parameters that should be included. So when we have to look at whether visual acuity will improve or not, we have to look at the following things: whether papilledema is present, whether there is visual loss, is the visual loss progressive, or is the atrophy already set in. We have been using the perimetry reports for a long time, and this study shows that there is significant correlation between the visual field sensitivity loss and the papilledema grade. Why it is so important to have many more parameters? Because according to this study, almost 24% people have become blind from the series they studied who had papilledema. The various risk factors, as we all know, are male gender, hypertension, anemia, black race, younger age, obesity, higher opening pressures, and severe papilledema and significant vision loss at presentation. So timeliness of surgery is important. And this timeliness of surgery will be possible only if we can detect the loss of neurons at an earlier stage, that is at the stage of evaluation. And therefore, the purpose of a study was to study the conventional artificial intelligence tools and Wolfram language analysis for predicting the outcome in papilledema. We studied 291 eyes of papilledema with early vision loss analyzed by conventional AI versus Wolfram language. We performed multiple regression analysis on these patients. The reduction of edema like this was included in the algorithms. We included photos like these, the pre and post-op, the pre and post-op 1 month, the fundus picture, the image of the optic disc, which was included and added to the algorithm of machine learning, and the analysis was made. These are the this is a study of the blood vessels of the optic disc. This is an unclassified picture of various optic discs photographs. And this is after the segmentation has been done, where we can see that it can be graded into grade 1, 2, and 4, depending upon the blood vessels visible. Here also, as we can see, the vessels near the blood, near the optic disc get removed as the papilledema progresses, and they reappear as the papilledema improves. This is Haralick's entropy, which was also included. These are basically the features of the retina, the texture features, which show us the level of disorder in the retina when there is papilledema, and the order is restored when the papilledema subsides. We also studied the images of the optic disc. We all know the Frisson grading of papilledema. However, the indices that we included in our study were vessel discontinuity index, obscuration around the disc margin, nasal to temporal ratio of disc margin obscuration, vessel discontinuity index to disc proximity, area of the largest region in the vessel map, superior, central, and inferior segment nasal to temporal ratio, disc margin obscuration in the nasal and temporal poles. Then we introduced the Wolfram language, which further refined our algorithms. It is basically a unique engine which uses algorithms to do analysis, answers the questions, and generates reports. It further improves the prediction of success and guides treatment. This is the Wolfram Mathematica software or the website which we use for our algorithms. The method we basically followed was that the cases were selected and rejected based on what the algorithm told us. And then we analyzed them post-op. We also compared cases which were done when the algorithm was suggesting that it would suggesting failure. And we also compared cases who refused surgery in spite of the algorithm suggesting success. So we tried all possible combinations and put it in the algorithm. We also put pictures like these, that is the dynamic retinal pulsations, which show us micropulses at various levels. And these help us to identify either the papilledema getting worsened or better. We also use fractal dimension analysis. This is basically creating a small quadrants of the optic disc and in analyzing each quadrant separately for pre and post treatment, whether operative or medical. And then we get the various grades that can be classified. These are the pictures which were included, which had the pre-op picture on the above frame and the lower frame showing the post-op pictures where the papilledema is resolved. Such pictures such as the Bruch's membrane analysis, where you can see indentation in the Bruch's membrane when the papilledema increases and flattening when it settles. Also pictures of newer parameters like VEP, color vision, and choroidal folds are being now included in our algorithms. So the results said that the algorithm in its conventional form had sensitivity of 89% and specificity of 82%, while the Wolfram had sensitivity of 84 and specificity of 89. Combined, they give accuracy of 90% in predicting the outcomes of therapy. There have been algorithms already used for diagnosis between optic neuropathies and pseudopapilledema, but none which have been used for giving the prognosis or predicting the outcomes of a therapeutic intervention. So we conclude that if the algorithm allows surgery, only then you should operate. And combined algorithms give better prediction. These are our references. Thank you very much for a patient listening.
Thank you very much. Judges, your questions, please. Questions from the judges? Okay, if the judges don't have any questions, would you like to ask any questions? Okay, so shall we go on to the next paper? Yes, Susan, please. Yes, Susan.
I had a question whether the the expertise of the photographer and the signal ratio, all these things are also being taken into account in the algorithm.
Yes, madam. We actually have a team who are allotted tasks, and each one has to do the same task every time. We try to maintain that bias actually, so that there is no user bias in all these acquisitions.
So do you remove some of the pictures which are not of the required quality?
Yes, definitely, madam. We actually have access to multiple machines and as well as engineers from IIT who help us with all this. And they, apart from the clinicians that we already have, so we have certain criteria of taking these pictures, and if they don't fit into that, then we definitely discard them.
Would the patient having cataract or any other media opacities, does this affect the results? And would such patients also therefore be considered to be out of the algorithm?
Yes, madam, because see, we are we had already presented the initial part of this paper last year where we had the clinical findings also included. Today, we only spoke about the algorithm in terms of the artificial intelligence, where what data we feed in. But if you ask me the entire thing, then we definitely look at these factors, like whether the vision acuity is affected because of cataract, and then we definitely would not like to include such patients in the findings.
Thank you. That's instant.
Thank you.